Welcome to today's podcast. I am Dr. Rodriguez, and I am joined by Jamie, who was diagnosed with leukemia and has experienced firsthand the challenges of this disease. Would you share a bit about yourself and your experience with leukemia?
Hi, I'm Jamie. I'm 19 years old, and I was diagnosed with leukemia when I was 15. It's been a rollercoaster from diagnosis to treatment and coping with the side effects.
Could you elaborate on the process of being diagnosed with leukemia and what that felt like for you?
It started with persistent fatigue, frequent infections, and bruising. The diagnosis was confirmed through blood tests and a bone marrow biopsy. Hearing the diagnosis was shocking and overwhelming. It felt like my world had turned upside down.
It must have been very tough. Now, leukemia is a cancer of the blood-forming tissues and can be very aggressive, requiring immediate and intensive treatment. It affects both adults and children, disrupting normal blood cell production in the bone marrow. Jamie, can you tell our listeners about the treatment process you went through?
I underwent chemotherapy, which was intense and had several side effects, like nausea and hair loss. Afterward, I received a stem cell transplant, which required a lengthy hospital stay. The recovery was tough, both physically and emotionally.
I'm sorry to hear about the difficulties you faced. Now, the treatment for leukemia can indeed be very intensive, often involving combinations of chemotherapy, radiation therapy, stem cell transplants, and targeted therapies, which focus on specific leukemia cell vulnerabilities. These treatments aim to remove leukemia cells and allow normal cells to form in the marrow again. However, these treatments can also have profound impacts on the patient's quality of life, affecting both their physical and mental well-being. Can you share more about how the treatment impacted your life and how you coped with it, Jamie?
The treatment had a tremendous impact on my life. I had to be isolated due to a weakened immune system, which meant being away from friends and family. Coping with it involved a lot of support from my loved ones, counseling, and focusing on small, daily achievements. Mental resilience became as crucial as physical strength.
Indeed, support from loved ones and mental resilience are crucial in battling leukemia. Now, there are several risk factors for leukemia, including genetic predispositions, exposure to certain chemicals, and previous cancer treatments, among others. While researchers are still working to fully understand the causes and development of leukemia, advancements in medical science have led to better diagnosis and treatment options, improving the prognosis for many patients diagnosed with this disease. Jamie, can you share any advice for individuals who have recently been diagnosed with leukemia or are undergoing treatment?
My advice would be to educate yourself about the disease and treatment options. Stay connected with loved ones and consider joining a support group. Focusing on a healthy lifestyle, including proper nutrition and regular exercise, can also help in managing side effects and improving overall well-being. Lastly, stay hopeful and take each day as it comes.
Great advice, Jamie. Thank you. And thank you for sharing your journey and insights with us today. Understanding the experiences of those who have been through leukemia treatments is crucial in developing better support systems and improving patient care. Our thoughts and support go out to anyone dealing with leukemia or any other form of cancer. Keep informed, stay strong, and always hold on to hope. Thanks for joining us in this enlightening conversation about leukemia.